First tonight, our Call 6 team going to the state's top leaders to uncover what's being done to fix a dire problem throughout Indiana. Babies and mothers are dying here at a higher rate than in Iraq and the Gaza Strip.
Last night, we introduced you to two women who have to drive an hour to be seen by a doctor throughout their pregnancy. They'll also have to travel that same hour in labor to deliver their babies. Our
Call 6 Investigates eye-opening report found women in a third of our state don't have a hospital in their county where they can receive prenatal care.
Only on RTV6, Stephanie Wade takes that information straight to the governor and the state health commissioner to see what is being done to help our most precious population.
623 babies didn't live past the age of 1 in Indiana in 2016. 623. We can and we will save more of them.
That was Governor Holcomb last year at his State of the State address, promising to make Indiana the best state in the Midwest for infant mortality by 2024. As it stands now, Indiana ranks the 7th worst in the country and 3rd worst for maternal mortality. After requesting for 2 weeks to sit down with the governor to discuss this issue and getting nowhere, we decided to show up to one of his public events and ask our questions there. You made reducing infant mortality one of your targeted issues as governor. What have you done and what resources have you dedicated to doing that?
Well, there is more funding, but most importantly, there's more boots on the ground, zip code by zip code where the need is the highest. What we've started to do is having OB navigators on the ground in the home throughout the whole process.
The OB Navigator program he's referring to was signed into law earlier this year, committing $3.3 million to connecting women in the highest risk areas with home visitation services.
Well, how are you?
During and after pregnancy. But nearly a year later, women are yet to receive those services. In fact, the State Department of Health plans to roll out the program in January. They spent the past few months meeting with hospitals in the 20 counties struggling the most. Women living in a third of our state either don't have a hospital or don't have an OBGYN physician in their own county, so they're having to travel out of county to be seen by a doctor.
Yeah, and those navigators are traveling from neighboring communities to get out into those rural areas that I think you're referencing. We need to do a whole lot more of that.
Is that acceptable?
But it certainly is a concern. And how can we get prenatal care at least closer to home for these women?
I also caught up with the state health commissioner, who Governor Holcomb appointed in part to focus on this issue because she's an OBGYN herself. Is there a way to try to incentivize hospitals to not close their doors, to not close their maternity wards?
So it's really hard because whether you do 50 deliveries a month or you do 2,000 deliveries a month, you need to have certain basic services. You need to have pediatric care for your baby, some type of a newborn ICU or at least a newborn unit. And all of that costs a lot of money for a hospital system to maintain. And if you're not doing a large amount of deliveries, that can be difficult.
What is the solution?
So I think the solution is that these have to be community-based solutions. We as a state can work to give funding and to support programs and resources as the governor and our legislators have done, but then we need to work community by community to help them to bring together their home visitation services, to bring together their hospital systems, their healthcare providers.
It's going to take time because of the duration of the commitment, but we're starting to see positive indicators. We just need to do a whole lot more of it statewide.
Now, once the OB Navigator program rolls out, we intend to follow them along and show you what it looks like and how you can get involved if you need help. In the meantime, though, what resources are available now if you're pregnant or a new mom? You can call the Mom's Helpline at the number on your screen right now. It's 1-844-624-6667. Again, that's 1-844-624-6667 to find help near you. I'm Call 6 Investigates' Stephanie Wade.